I'm Kasra Saeb-Parsy. I'm a consultant urologist based at Cambridge University Hospital in Cambridge, UK. I specialize in the treatment of benign enlargement of the prostate and performing Rezum as well as laser surgery. I also specialize in management of patients with stone disease as well as diagnosis and management of patients with prostate cancer. So Rezum is a fairly new procedure which has come on the market, and it is something we call a minimally invasive treatment, where we use steam injection into the prostate in order to cause shrinkage of the prostate. So the steam delivers heat energy into the prostate, and that allows the cells to shrivel up over time, and the body absorbs those cells and therefore opens up the channel, the prostate. So as we get older, the prostate gets bigger and it becomes like a pipe, a lead pipe, which is further up. So it becomes narrow, and therefore the flow of the urine reduces in men. So what Rezum wants to do, or what we try and do with Rezum, is to restore the pipe diameter, i.e. open up the pipe and therefore allow men to pass urine more effectively, to back what they were like before the prostate got bigger. And the process of enlargement of the prostate is very common, and most men go through it. The majority of men will have problems with their waterwork, and most of the time this is as a benign enlargement of the prostate. And by the time men reach the age of 80, almost all of them will have problem with their enlarged prostate, and this process starts much earlier, from the age of 40, 50 onwards, and gradually creeps on men. So Rezum is trying to reduce the size of the prostate, open up the prostate to allow patients to be able to pass urine more freely. So here in the UK, we tend to perform Rezums in hospitals or in what we call a day cases, in daycare units. But it were a very short visit to the hospital or the center where they're providing the treatment. It will be what we call a day case. So therefore you go in, you have the procedure done, and then you go home the same day. So it is a day case procedure performed in a hospital or in a practice where they've got access to the equipment that we need to perform the Rezum. That's a very good question. As I said earlier on, Rezum has been around for a few years now, and we have collected data nationally, both in Europe and in America, on its effectiveness in terms of relieving patients' symptoms, but also on its ability to maintain that improvement in symptoms. And when we've followed up men for 5 years, what we have found that over 95 out of 100 men who underwent the Rezum treatment were able and were satisfied their symptoms after treatment with Rezum for the following 5 years, so therefore did not require any additional treatment. And that is much better success rate to some of the other minimally invasive treatment, such as the urolift and prosthetic artery embolization, which are the other minimally invasive treatments available. Of course, there are other options like using laser, which is probably more effective, but it will have possibly a higher side effect profile compared to Rezum, and that's why many men prefer to go down the route of Rezum, because one, it is very effective, and the improvement is maintained over a long period of time, but also the side effects of it are very low. The Rezum treatment, in terms of the duration, how long does it last for? As I said, we have data which shows that majority of men who have Rezum had a good response, and this, we know that when we follow them up for over 5 years, they've all maintained the response. So we don't know how much longer the effects would last, but the data that we have so far, it shows that it lasts at least 5 years, which is a very good result for something which is minimally invasive, something which is also very quick to perform and with minimal complications and side effects. No procedure is without discomfort or without any side effects, but most patients tolerate the procedure extremely well. It can be done under general anesthetic, it can be done under sedation, or it can be done on a combination of local anesthetic and other medication to help the patient undergo the procedure. Of course, every procedure has some discomfort associated with it, and there are very minor side effects associated with Rezum procedure, but as I said, these are very small and most people tolerate it extremely well. One of the advantages of Rezum is that the patients are often worried about problems with erection after surgery on the prostate, or concerned about what we call retrograde ejaculation or dry orgasm. So the advantage of Rezum is that the likelihood of it causing any problems in erection as a result of the operation is extremely low, and the likelihood of patients developing what we call retrograde ejaculation is again very low, less than 10%, while this is much higher with other treatments such as laser treatment. And one of the other things that patients often worry about, particularly the younger patient, is the risk of big incontinence, i.e. losing control of their urine after surgical treatment for prostate and having to wear pads or leak urine in inappropriate places. So one of the other advantages of Rezum is that the risk of patients developing incontinence is extremely low and very rare for patients to experience that as a result of Rezum. So overall, it's a very successful treatment with very low side effect profile, both in terms of the sexual function, but also importantly with regards to being able to control the urine after the procedure.